Good day. My name is Maria Ella T. Guerrero, Financial and Management Officer 2 of San Lazaro Hospital, and also the Vice Chairperson of the Technical Working Group of the Hospital Finance Manual. Today, I will give an overview of the DOH Manual of Standards for Management of Hospital Finance Service First Edition. The training module for this manual is still being developed and will be accessed via the DOH e-learning platform soon. The outline of this presentation is as follows. We have the introduction, overview of the Manual of Standards for Management of Hospital Finance Service First Edition. We have the brief description of the chapters and the Hospital Finance Service Self-Assessment Tool. To start, let me give you a brief description of the Health Facility Development Bureau. The Health Facility Development Bureau, or the HFDB, is under the Department of Health, Health Facilities and Infrastructure Development Team, or the HFIDT, which is led by Undersecretary Lilibet David. The HFDB, headed by Director Maria Teresa Vera, has an administrative unit and 3 functional divisions, namely Policy, Planning, and Program Development Division, Health System Development and Management Support Division, and Research and Performance Management Division. The HFDB mandates are the following. First, it develops plans, policies, programs, and strategies on health facility development, planning, operation, and management. Second, it provides coordination, technical assistance, capacity building, consulting, and advisory services related to health facility development planning, operation, and management. And third, they advise the Secretary and the Undersecretary of Health on matters pertaining to health facility development, planning, operation, and management. We now go to the main topic of this presentation, the overview of the DOH Manual of Standards for Management of Hospital Finance Service First Edition. Previously, the Finance Service was only a chapter under the 2008 edition of the Manual of Organization and Management of the Administrative and Finance Service for the hospitals. The first edition of the Manual of Standards for Management of Hospital Finance Service fulfills one of the deliverables of the Health Facility Development Bureau, as well as the vision of the members of the manual's technical working group. The organization of a hospital finance service, as separate from the administrative service, was mandated in Department Memorandum Number 183 Series of 2000, or the implementation of policy guidelines and standard operating procedures on finance management reforms. At the time when the health sector reform agenda identified the need for a strong financial management system to achieve efficient, effective, and sustainable hospital operations and management. This was supported by the Department of Budget and Management when it approved the hospital organization and staffing standards in 2013. This manual shall serve as reference and guide for hospital administrators, financial and management officers, and staff in the operations and management of hospitals to ensure the efficient and effective delivery of quality healthcare services. Shown here is the cover of the Manual of Standards for Management of Hospital Finance Service. In 2016, this manual, together with the other HFDB hospital operation and management manuals, were developed in support of the DOH HFDB Integrated Hospital Operations and Management Program and Continuous Quality Improvement Program. This manual is guided with the relevant legal framework covering government financial management systems. It also supports the mandates of the Presidential Decree Number 1445, or the Government Accounting Code of the Philippines, and Government Accounting Manual for National Government Agencies, or the GAM for NGAs. As mentioned, the HFDB Hospital Operation and Management Standards Manuals are part of the following DOH programs: First is the Integrated Hospital Operations and Management Program, or commonly known as IHOMP. It is a set of guidelines which aims to improve efficiency and effectiveness of healthcare services through creation and use of information for clinical, administrative, and monitoring purposes. Second is the Continuous Quality Improvement, or CQI, which is the performance management arm of the National Quality Framework in Health. It ensures that all consumers receive the highest quality and most cost-effective health services through the development and maintenance of a qualified, diverse, and accessible multidisciplinary network, care, and service organizations. The manual shall be divided into three major parts. Part 1 covers the introduction and discussion of the basic principles and concepts to be used as basis for the implementation of an effective financial management in public services. Part 2 covers the discussion of the functions, standard policies and procedures of the core processes of the different departments, sections, units under the finance service, and the role of the Financial Management Officer 2 as head of the finance service. It shall also cover the chapter discussing the finance management system in specialty hospitals and local government hospitals. Part 3 shall provide the user with reference in handling the management and operation of the finance service. It shall cover the discussion of concepts and principles in good governance, social responsibility, performance-based evaluation, and financial risk management. It also includes revenue and cost management, and quantified free services and discounts to set a common standard in handling the resources of the hospital. Let me discuss to you the short description of each chapter. Part 1 covers chapters 1 to 6. Chapter 1 shall cover the introduction, stating the short background, coverage, structure, contents, purpose, and intent of the manual. In chapters 2 and 3, the discussion covers the basic principles and concepts to be used as basis in the implementation of an effective financial management in public healthcare institutions. It shall include the following: overview, covering the statement of vision, mission, objectives, and core values of the Department of Health and Finance Service, and legal framework, general policies, and guiding principles in financial management. Chapters 4 and 5 illustrate the basic organizational structure for the finance service at all levels of hospital service capabilities, levels 1, 2, and 3. It also includes as reference the space and equipment requirements to operate the different units under the finance service. Chapter 6 discusses the different roles, accountabilities, and responsibilities of the finance service in the operations of the hospital. It also provides concepts and principles to effectively and efficiently manage the finance service as to responsibility, accountability, and liability over government funds and property, disbursement of public funds, benefits of and activities to achieve good financial management, integrative approach to financial management, integration of financial management processes with critical hospital operation processes. Part 2 covers chapters 7 to 13. Chapter 7 identifies the roles, duties, and responsibilities of the Financial Management Officer or the head of the finance service in the performance of their mandated functions, by setting standard policies and procedures and the strategic process map indicating the general supervision of the different units under the service. Chapters 8, 9, 10, and 11 discuss and define the different functions governing general policies, interested parties, both internal and external, accountabilities, duties and responsibilities, major core processes, and the reportorial and documentary requirements of the following departments under the Finance Service: the accounting, budget, cash operations, and billing and claims. Chapter 12 discussed the financial management system in government-owned and controlled specialty hospitals. It also includes general policies, financial transaction flows and processes, including the system's reportorial and documentary requirements. Chapter 13 covers the discussion of the financial management system in hospitals under the local government units. Part 3 covers chapters 14 to 18. Chapter 14 discusses the good governance and social responsibilities in hospitals in accordance with the DoH mandate and objectives in the implementation of universal healthcare. Chapter 15 provides the guidelines, principles, and formula in setting rates, cost management, and revenue enhancement for hospitals. Chapter 16 discusses the purpose of setting up, computation, and recording of quantified free services and discounts. Chapter 17 identifies the common financial risk management, and its impact to effectively and efficiently manage the finance service. Chapter 18 discusses the strategies, tools, and resources in establishing performance management system in finance service and programs for continuing quality improvement of the quality management system as to processes in the delivery of services. In appendices, the following are included, which can be used as reference of the user of this manual. You have the glossary of terms, which are common financial terms as defined based on the DBM and COA standards. We have the illustrative chart of accounts, list of book of accounts, common forms used based on GAM for NGAs, RA 11223, otherwise known as Universal Healthcare Act, RA 11463, otherwise known as Malasakit Center Act, and other pertinent issuances and references. The first edition of the Manual of Standards for Management of Hospital Finance Service includes two tools that the finance officers can use to assess or monitor their compliance to the standards. These are the Finance Self-Assessment Tool and Reporting Tool of Financial Data on Revenues and Expenses. Let me talk a little about the Finance Service Self-Assessment Tool. This tool is based on the content of the manual and may be used to gauge your hospital finance service compliance on the standards and performance. Flash on your screen is the cover of the first edition of the Manual of Standards for Management of Hospital Finance Service. The manual has been circularized last May 2021 under Department Circular Number 2021-0189. You may access a copy of the manual together with the other HFDB standards manual through the link. Before I end this presentation, let me share with you other programs lodged under HFDB. These are the systems, programs, projects, and databases being handled by HFDB. You may contact us for more information on the programs mentioned in this presentation at the following details. For hospital finance service management specific queries, please email us at hfmsm@doh.gov.ph. Maraming salamat po.